Certainly seems like no easing of COVID-19 on us here in central New York, really most of upstate New York.
So let's talk more about this. Upstate Global Health Director Dr. Stephen Thomas joins us once again this week. And good to see you again, Doctor. Thanks for being here.
Good to see you.
So let's take a look at our numbers. They seem to be going back up. They were already high. Deaths from COVID happening every day in the region. I mean, we had 6 in Onondaga County just since Friday, 4 in Oswego. 105 Onondaga County residents in the hospital. I mean, we could go continue through the numbers. You've looked at it. What do you make of the data we're seeing right now?
Yeah, we've definitely stalled, right? And unfortunately, we're like a lot of other counties in the United States, which have also kind of stalled in their COVID number decrement. I think it's a couple reasons. You know, number one, you got to remember 1 out of 3 people is still not vaccinated. That's, you know, for the country, for the state, and for our county. Number 2, Delta is the strain that is circulating in the United States, and it's a highly infectious strain. Number 3, people are starting to gather again. So people are coming in from the outdoors. You know, we had a little bit of snow this afternoon, so people are very closely approximated to one another, and people aren't really wearing masks much anymore, unfortunately. And then there's also, you know, in some populations, people who had been vaccinated, some people need boosters, right, to maintain their immunity. So I think all of these things are kind of mixing together to create this situation.
All right, you just mentioned boosters. What about boosters for everybody? Pfizer's going to be asking the FDA for it. And the governor basically said today, if you feel at risk, go get that booster.
Yeah, you know, I don't know if a booster is necessary for everybody right now, but I do feel that eventually everyone's going to need at least 3 doses of this, at least these messenger RNA vaccines, and probably a Johnson & Johnson as well, to really have some durable immunity. The people that I would absolutely recommend getting a booster now, anyone over 65, anyone that has any other medical problems like especially diabetes, kidney disease, heart and lung disease, any kind of cancer or malignancies. And then those people that it's authorized for who may not have those problems, but are over 18 and live in group settings or work in high-risk environments, such as first responders, people working in the medical field.
Doc, we heard so much about the herd immunity concept when this was all starting and vaccinations were happening and kind of had a 70%, I think, number roughly. Do we need to just forget about herd immunity or up that percentage, especially with Delta variant being so strong now? Like, what do you think about that?
Yeah, I mean, as a concept, it's fine to embrace the, you know, the concept. It's you know, something worthy to shoot for, because, you know, that's why we don't have measles all the time and mumps, rubella, and other things like that. But I'm not sure how productive it is to focus on it. I mean, to me, I would say, you know, as it relates to getting people vaccinated, focus on each individual person, each individual family, each individual community, your county, you know, your region. But, you know, I would keep it local, and anyone who hasn't been vaccinated, you know, try to figure out why, get their questions answered, and hopefully they'll make a decision to get vaccinated.
All right, this has been in the news a lot lately. We haven't talked about this with you yet. The Pfizer and Merck have developed a pill to treat COVID-19. How good is that pill, and what do you think it might mean for getting us out of this pandemic?
Yeah, so these are drugs that are designed to to make sure that someone who is at high risk of a bad outcome if they do get infected, to try to keep them in the mild end of the spectrum. So these are pills that are given to people when they get infected, and you can diagnose them early and start treating them early. They have a good rate, you know, 50, 75% ability to prevent people from going on to severe disease. So it's not going to protect people from getting infected. It just might protect them from having severe disease, maybe ending up in the hospital or dying.
All right, neither one approved just yet, so we can come back to this one again. More pressing, Thanksgiving. It's about a week and a half away, something like that. What's your advice to people about gathering for this holiday? We'll keep it to this holiday for now.
Well, I would make sure that you think about getting vaccinated if you're not vaccinated. I'd make sure that any of your guests who are going to be coming over to your house are also vaccinated. And if you have vulnerable people in your home, so people who can't be vaccinated, or people, even if they are vaccinated, have some of those underlying medical conditions that I was mentioning before, I would keep the guest list small, because every additional person that you bring in there increases the increases the risk that someone could be infected and pass it on to that vulnerable person. So that's where I would start.
Right, and those of us with college kids, we're a little concerned about them traveling home for Thanksgiving in terms of the spread of COVID-19, and then the students who live outside the area going home, coming back to local colleges. What advice would you have for us college parents?
Yeah, you know, when you look at some of the places in the country, even some of the states that have the highest rates of vaccination, they are still seeing increases in cases in certain places, and in most of those instances, it's younger people, so it's people under 30, because they're less likely to be vaccinated, they're less likely to follow, wear masks and do social distancing and things like that. And we do know just from our own local experience that there are lots of infections, in colleges, unfortunately. So yeah, so it is a real risk. Again, I'm a broken record, I'm sorry, but if those kids are not vaccinated, you should absolutely try to get them vaccinated. And you need to be in the lookout for, whether or not they're not feeling well when they arrive home. Unfortunately, there's no allergy season anymore, right? There's no common cold. Everything is COVID until it's proven otherwise, because it can spread so fast and it can cause so much damage in people. So that's unfortunately the situation we're in right now.
Dr. Stephen Thomas, thank you, sir, for joining us once again. We'll have you back really soon, because this thing continues to seem to change so quickly. We need to have you on regularly.
Yeah, absolutely. Thanks a lot.
Thank you, Doctor.
Moving on, this is the